Good morning. Yellowknife and N.W.T residents have done their best to minimize harms from COVID-19 for over a year now. But I'd like to start out today by saying there is a need for ongoing vigilance. The Office of the Chief Public Health Officer and Yellowknife Public Health have identified approximately 90 people who are contacts to 5 cases in Yellowknife that are part of the same cluster. A cluster refers to cases that are clustered in time, geographic location, or by common exposure. I have not declared an outbreak at any location or advised any facility to shut down. I want to assure the public that we are prepared for this and that our office and the regional health authorities are implementing processes and procedures as we should be. What this means is that we are communicating with everyone who needs to be notified. Parents in particular are being sent today specific directions and reminders regarding how to navigate self-isolation with their teen or child. If you have not been notified, you should go about your daily routine today, as you did this time last week and the week before that, while following the public health guidelines we have stressed throughout the pandemic. You are empowered to avoid COVID-19. Each resident has the information needed to make N.W.T a safe space. We can all do our best to keep this safe environment by following public health guidance the best we can. Try to control the things you can control. This means following the healthy practices that we know work to stop the spread of COVID-19. That means keeping physical distance at least 6 feet or 2 meters apart, wearing masks when you're out, especially in indoor public spaces, keeping crowds small and spaces large, washing your hands frequently, staying home even if you're feeling a little sick, calling your healthcare provider or local health center to be assessed if you have any COVID-19 symptoms, and self-isolating responsibly whenever required. Yes, there are currently many in the city of Yellowknife today that are required to self-isolate as we work through this cluster. This is more than anything else a safety measure. We must stop this cluster from becoming an outbreak by asking individuals who may have been exposed to stay home to prevent potential spread. We need to contain spread now to ward off COVID-19 and continue the stability the N.W.T has been experiencing for months now. By sticking to these simple habits, we can protect ourselves and protect each other. Getting vaccinated is also important. Vaccines will help us defeat COVID-19 and get back to doing the things we love. The vaccine is here, it's safe, it's effective, and it's available. So make an appointment if you haven't already. And if you have received your first dose, make sure you book an appointment for your second dose. We are currently awaiting test results from the contacts we have notified. Outside of these cases identified in the cluster of 5 cases, results have come back negative, and we're waiting for the test results, and we'll be testing on a frequent basis. We are also still waiting test results as to whether confirmed infections are caused by variants of concern. We will continue to notify the public about the proportion of infections that are caused by variants of concern. Until then, be patient and take control of your own risk. If new cases are announced this week, I want to explain that there is a difference between those that have been linked to the cluster and community spread. Right now, we have a map. We know who is connected to whom, and that matters. It means we have some control over the situation, and I do want to reassure you of that. Now, I would like to tell you about what I can't tell you. And it is important to recognize your responsibility in keeping calm as well. Each incident is reviewed on an individual basis. Reducing risk and respecting privacy are key priorities for the Chief Public Health Officer. Privacy legislation mandates that no details about contact tracing investigations can be shared. We know that residents are concerned about allegations of individuals posing a risk to others by not following the rules and recommendations. While we do understand there is a public interest in the details of any potential investigations, I will be not taking any of those types of questions. If a high-profile member of the public has made statements on his or her own accord, we will not be confirming any details. The N.W.T is committed to following due process set out for these reasons. This briefing is to answer common questions of concern. I stated at the beginning that there is no need to panic. This does not mean that there's no reason to be concerned, and concern is very justified right now. I have explained that we are working on this, and I have told you that we can tell people to ensure that they know what they have the ability to do that is within their own control. This is also important. So reducing our risk requires collective action from everyone across our territory. One of the most powerful steps to take is to avoid any travel outside the Northwest Territories if you can. The risk of contracting a COVID-19 variant of concern during travel is real. For students in particular, for those experiencing any of the major COVID-19 symptoms, including fever, cough, difficulty breathing, or loss of taste or smell, they cannot attend class until they have been assessed by a healthcare provider and provided with information when they can return. If they experience any of the minor symptoms, they need to stay home for 24 hours. If symptoms have resolved, they can return to school. If they do not or more symptoms show up, they must stay home and consult with a healthcare provider on next steps. These are common sense guidelines which will protect public health while reducing disruption to learning. So these sacrifices are not easy. We have been at this at a long time. The last few days are a stark reminder that we can't get complacent. This is why we also postponed the release of the Emerging Wisely plan to the end of May. With 8 cases currently in the Northwest Territories that occurred in 1 week, this is the time to focus on containment. With a few more weeks, we can also give the rest of Canada some time to catch up and get the third wave of outbreaks under more control. Again, we all need patience, but we notice the toll and we feel it with you. Everyone working on this pandemic feels it. We have had a difficult week, but Yellowknife and our territory are resilient. We'll get through this, and together we can defeat COVID-19. Thank you.
Thank you, Dr. Pegg, for those remarks. And now I'll turn it over to Dr. Kandola for those remarks. And now I'll turn it over to Dr. Pegg to say a few remarks as well. Dr. Pegg.
Thank you very much. At this time, I would like to also once again extend my thanks to the population of Yellowknife, who have responded again to a call for widespread testing in light of the wastewater signal presented to get tested, and for everyone who continues to self-isolate when needed. The NTHSSA is supporting the public health operational response in a number of ways. Currently, the Stanton laboratory is on surge mode, and as of this morning had processed close to 900 tests in the previous week, approximately 200 per day, with a turnaround time of just over 24 hours, which is impressive. The rapid response team has been deployed to the isolation centers to provide testing support. Additional nursing and support staff resources have been added to Yellowknife Public Health in order to assist with contact tracing, and further extra nursing staff are on standby to assist with contact tracing if needed. Daily meetings are occurring between the NTHSSA and the Office of the Chief Public Health Officer in order to discuss case management. Vaccination clinics also remain ongoing. And again, I also urge anyone who has questions about the vaccine or is interested in getting vaccinated to contact your health center or public health department for more information, or to check our website, gov.nt.ca/COVID-19, or to book an appointment for vaccination in Yellowknife, you can search NTHSSA COVID vaccination. The situation is a stark reminder of how fast this virus can move and how only a few cases can involve dozens of contacts. But I'm once again impressed by the willingness of Northerners to come forward to get tested and to protect our community. This situation can certainly seem stressful, but one thing that we can do to act against our stress is to continue the actions to keep our community safe that we've been practicing for the last year. Isolating if needed, monitoring your symptoms, getting tested if needed, are all actions concretely that we can take to keep ourselves and our community safe. There are also resources available at the N.W.T helpline, 1-800-661-0844, or available on Facebook, or through your healthcare provider if you're finding the situation very stressful. Public health only works with public investment. We're certainly seeing this once again as we respond to the situation in Yellowknife today. Thank you.
Thank you, Dr. Pegg, for those remarks. Now we have reached the Q&A portion of this media briefing. So I'll just be going through the roll call here as no particular order. But first off, Thomas with Radio Taiga and Lac-Guyon, do you have a question for either Dr. Kandola or Dr. Pegg?
Yes, good morning. First, can you hear me well?
Loud and clear.
Okay, perfect. Thank you very much. So our first question from the team. The first communications to the public from the public health said that there were, I think, 40 close contacts in one school in Yellowknife. It seems that it worried every parent who had a child in any schools. It is very likely that word to mouth will quickly unveil this information to the public. Why not mentioning that school from the beginning?
So I can answer that question. When we do the investigation, we do an exposure notification if we have any concern that we haven't captured all the contacts, and we try to at all times maintain the privacy of institutions, whether it's a fitness center, school, or a restaurant. And in this scenario, we work diligently and we're able to define an exact time period and exact exposure contacts and be able to contact them. So we had a time period on that particular day. We had students and staff that were exposed, that we had their names and we knew exactly where that exposure occurred. In that scenario, we tried to release the minimal amount of information because we had reached out and contacted the students that evening and the next morning, and we were able to tell them to isolate. So the additional information of adding the school wasn't going to provide us any more contacts or exposures. The school in itself decided to come forth and identify themselves, but whether it's a school, restaurant, or fitness center, if we know who the contacts are, we can reach them, we can tell them to isolate. We don't typically do an exposure notification.
Perfect. And I would have a follow-up. It's about the definition of close contact. We will need precisions. Let's say one person spent 3 minutes in a restaurant at the same moment of a case of COVID. They don't enter into the definition of a close contact, but they must self-isolate for 14 days, if I understand well. Do you interview those possible contacts to make sure they were really a close contact, and then so they possibly won't have to self-isolate for 2 weeks?
That's an excellent question. So in a scenario where we have to do an exposure notification because we can't reach all the contacts, we provide the time period and we make a high-level recommendation that if you were in that location during that time period, that you self-isolate. But if we are able to know the contacts of the people who are in that time period, reach out, we can do a more detailed public health risk assessment and provide appropriate advice. And so what we are asking to people is, we don't know how much time people have spent. We don't know their situation. And to get that more granular public health risk assessment, we actually have to get details from the person in question. So we do ask them to call YK Public Health and be assessed in a more detailed public health risk assessment.
Thank you.
Thank you, Dr. Kandola. Ollie Williams with Cabin Radio, do you have a question for either Dr. Pegg or Dr. Kandola?
Yeah, thanks very much. I'll start with Dr. Kandola if I can. Last week, we heard an MLA say they'd been told by a medical expert that some variants of the virus can stay in the body for 17 days. What's the latest guidance as you understand it regarding variants of the virus and the 14-day period of isolation?
So the recommendations are still 14 days, and we would have to look at that information, but we do look towards the Public Health Agency of Canada, and in their technical advisory committee, they had done a recent analysis that says the incubation period for the variant of concern has no different from the wild type coronavirus. What we do know is that the majority of infections, if you're incubating, occur within the first 5 to 7 days, and that the second week you would have a lower risk of presenting with the virus. So worldwide, they have used 14 days as their cutoff for incubation. And there could be a small percentage that could go between the 14, 16 days, but to require that the vast majority isolate beyond that would be a risk-benefit analysis that's more in favor of sticking to the 14 days as per recommendations.
Thank you very much for that. Just to follow up on that, Dr. Kandola, how frustrated are you by the circumstances that led to the development of this cluster and to dozens of contacts? Do you share the Premier's view that there must be consequences if your orders aren't followed?
I'm not going to specifically address that question, but I'm a public health physician, and what I have told the public is we're in a third wave. We have increasingly high number of COVID cases occurring daily in the 6 major provinces. That's fueled by variants of concern, which are much more infectious. And so we're in high alert. So not only was I expecting cases to occur, I also expected those cases to be a lot more infectious, and I have not been proved wrong. What the state I'm in is a state of vigilance and readiness. And so I'm anticipating cases. We've had literally 8 in a 1-week period. We'll get more imports. And so it's about, we're so grateful that we have something like a wastewater signal that we can actually have a days ahead other people who don't have that early alert system. And then I am counting on the public to come forward and get tested. If we have a wastewater signal and people don't get tested, that's not going to help us. So my attitude is we anticipate cases to occur. We want people to come forward and get tested. And then we want to isolate and manage their contacts as quickly as possible. Because of the wastewater signal and because we have people coming tested, in this particular case, we haven't broken the chain of transmission. We can link every case to one import. So this is probably not the first scenario. We'll probably have more to come. The way we can prevent this is to avoid traveling as much as possible for non-essential reasons outside of N.W.T, or having relatives come for non-essential reasons in N.W.T, testing, getting vaccinated, and then coming forward when you have symptoms or if we see a wastewater signal.
Thank you, Dr. Kandola, for that, and Ollie for the questions. Kevin with True North FM, do you have a question for either Dr. Kandola or Dr. Pegg?
Hello, can you hear me?
Yeah, loud and clear.
Okay, last week you guys announced that the isolation period for those who are fully vaccinated coming back into the territory has been diminished to 8 days. As long as you get tested and the test result come back negative, does this affect that at all? Considering that the person came back and it was about 14 days after they came back and the case still spread around the territory? Thank you.
So just to, when we look at the data, 2 weeks after your second dose, you're considered fully immunized, and waiting for 1 week in isolation, the vast majority of cases would occur in that 1 week. Doing a day 8 test on top of that would pick up anyone with asymptomatic infection, and then requiring mandatory mask wearing for the second week and monitoring of symptoms. We feel that's reasonable. What's going to happen, the third wave will pretty much, a high number of cases will continue to be the issue for the rest of May, looking at what's happening down south. But as the vaccine rolls out and the number of cases go down, that importation risk is even lower, and that risk for the fully immunized traveler will be even much lower. So at this point, it's based on those parameters. What people also have to realize is if they get a vaccine and they travel out, within the first 14 days, they don't have any immunity. They're just the same as if they're not vaccinated. It's 14 days after your first dose, and if you're exposed then, that you have 92% immunity. So getting your first dose and then traveling to a hot zone still puts you at risk in the first 14 days.
Kevin, do you have a follow-up for either Dr. Kandola or Dr. Pegg?
No, that's good. Thank you.
Okay. Garrett with CBC North, do you have a question for either Dr. Kandola or Dr. Pegg? Or perhaps Joanne with CBC North? We'll get back to them, or try to. Brett with CKLB, do you have a question for either Dr. Pegg or Dr. Kandola?
Yes, thank you for taking my question. Dr. Kandola, what are your thoughts on communities independently imposing health restrictions, like in Klutzelke, where they've shut down their only school for 2 weeks, or in Fort Providence, where they are asking people to self-isolate if they have come from Yellowknife? So what is your reaction to communities doing this, and is your office coordinating with these communities? Thank you.
So for our Office of Chief Public Health Officer, we have privy to knowing the cases, knowing the contacts, knowing the test results of contacts and what stage they are in the isolation, and monitoring risk. So we have a good sense of the 90+ contacts. In fact, 85 of them have either tested or are awaiting their test results, and so far, other than the 5 we've identified in this cluster, they've been negative. You also have to realize that as each day passes, it gets colder and colder. Like if the exposure was 8 or 9 days ago, it's the chances of people consistently showing negative that in the second week or towards the end that they will test positive is getting lower and lower. So we're anticipating that in about 10 days we will be contacts from our last case, so the risk will be lower and lower. And so we are requesting, if communities are anxious or they have concerns, is to talk to us, and we'll explain why we would not recommend certain measures and what our guidance is. So if people take things into their own hand and it's not directed by the Office of Chief Public Health Officer, it would cause unnecessary disruption when you don't need to when the risk is so low. So we, at this point, can link every contact and every case to one cluster. To date, there hasn't been any indication that there's been breaks in transmission. And as we go further out, the risk continues to go lower and lower. And at some point, all the people will be out of isolation, and we can move on and start monitoring for further imports.
Brett, follow up for either Dr. Kandola or Dr. Pegg?
Yes, thank you. So are any additional measures being taken to ensure COVID does not spread to smaller communities? I think you touched on this a bit, but I'm just curious about that. Thank you.
The best measure is to start with a case, and we have very qualified public health nurses who are very experienced in doing a contact tracing investigation. So we start with a case, and then we go back and we identify all contacts related to that case. Sometimes to trigger people's memories, we pull open their iPhone, their bank statements, so that they know exactly who was exposed, who wasn't exposed, and then we reach out to those contacts, put them in isolation, and start testing them. If any of those contacts are in a small community, we would isolate them the same as if they were in Yellowknife. This is the best way to ensure we're isolating people appropriately and not inappropriately.
Thank you.
Lonnie with CBC North, do you have questions for either Dr. Kandola or Dr. Pegg?
Yes, hi, thank you. It's Leni, actually. I am wondering, have all the 90 contacts that have been identified, have they all been tested for COVID-19?
Five have not been tested as of yet, but all the remaining have either been tested and tested negative or waiting the test results.
Okay. Dr. Kandola, you acknowledged misinformation in a tweet last night, and there has been concern among the public since Thursday, maybe even Wednesday. Why did you wait until Monday today to answer questions?
Last week, we were working overtime and diligently to be looking at cases and working on contacts and isolating people as quickly as possible so that we can contain this exposure and not have any further situations where we could have community spread. So if everything's contained, that's the focus. So to do no harm, find the contacts of the cases and get them isolated and tested. That is of utmost priority. Over the last few days, as we were identifying cases and sending out public health advisories, there was an increasing number of concerns over social media, and it was felt that we should have this press briefing at 10 a.m. as quickly as possible to allay these concerns, but also to combat any information that could be misinformation.
Thank you, Leni. Mario with Radio Canada, do you have a question for either Dr. Pegg or Dr. Kandola?
Yes, I do. My question will be for Dr. Kandola. Dr. For that, we were anticipating more cases at some point in the territory. Now that we have these cases, why does it have to postpone your review wisely? And if you were planning ahead, the plan should take into consideration that cases will happen. Why the need to postpone again?
So when you, as a public health physician, you have to assess risk all the time. And with this, when we see Canada with the third wave not subsiding and a high number of daily cases, the stress on the healthcare system, which you're increasingly seeing in the last week or so, plus an anticipation with delays in Moderna vaccine for the rest of Canada, that they probably won't be able to achieve an adequate vaccine rollout until later in the May, and then you see the impact of having 8 cases occurring in 1 week, and then the impact on our public health resources because we're having the same staff that's been working the last 14 months, working evenings and weekends. And so now capacities are stretched. This week, we're containing contacts, and we're deciding whether it's community spread, whether to looking at our current stage. So if anything, we don't want to go back, but definitely this is not time to go forward. This is not a time on Monday to announce relaxing restrictions when we're vigilant right now whether we have to actually impose more restrictions. So the best scenario right now is to continue to be vigilant, to wait out the third wave for the rest of Canada, because we are actually seeing an increased number of travelers. So our risk, unfortunately, is for each traveler coming in is another risk for importation, and wait for that to subside, wait for our importation risk to subside and get a vaccine increased uptake, rest of Canada, and then move forward to relax restrictions. So given what's happened and given the amount of contacts and exposures, I would be more trying to maintain things as they are and try not to avoid imposing more restrictions, but definitely not going to be saying this is a time to relax restrictions, because that would not be based on a very good public health risk assessment of what we're seeing right now in Yellowknife.
Perfect. You mentioned the stress on your team. Can you give us the stress that the cluster is having on your team and on the health resources in the territory? What can you handle more? What wouldn't you be able to handle at this point?
It's typically if you have a case that comes in, a positive case, which we get all the time, what we tend to see is that we look at their contacts and exposures. Sometimes we have to do notices on flights, but we haven't to date had any transmission on flights. But if there is a cluster of cases and then there's a congregate setting, it adds to the number of contacts. So with 90 plus contacts and with the cases, it just adds to more supervision, more public health risk assessments, more monitoring, more testing. And so that's not typically the norm, but this week is a heavier week than what we've usually had. And we do know, unfortunately, based on what's happening and based on the number of active cases, and then just it being fueled by variants, and it's just more transmissible, that that we're not immune to where Canada is. So if Canada is struggling and they're not anticipated to be able to see a bend in the curve or an increased vaccine rollout in the next couple of weeks, we're going to have to be mirrored to Canada's schedule and maintain things as we are, because when the risk decreases for the other provinces, the risk of importation will decrease to us, and we won't be having scenarios where we will have exposures in larger congregate settings, and that will make it a lot more manageable.
Thank you, Dr. Kandola. Dr. Pegg, I was wondering if you might be able to weigh in on that question as well about public health capacity and the impact that has on the people in public health who are doing all this work.
Certainly. The public health resources have been working at and certainly beyond capacity for a number of months now, and have done an amazing job responding to the calls for wastewater testing, to the outbreak at Fort Liard, to some of the outbreaks that we've had in the mine settings, and certainly now to this cluster that's occurred here in Yellowknife. As we continue to move forward, what we're looking to do is making sure that capacity is maintained by providing additional human resources so that staff are able to get some rest and be able to continue to do their job at the capacity that they need to be able to do it. As I mentioned, the rapid response team has been providing support to the isolation center to support the testing capacity there, and also to limit movements for people out of the isolation center. and that we're certainly also providing help for contact tracing. The contact tracing is a pretty specific skill set. It's important that it's done in a systematic way. It's important that it's done by someone who has the training in order to do the almost detective work necessary to tease out the details around a case and their potential contacts and the risk to those individual people, and then to make the call in order that those people who may have been affected are able to isolate and get tested. And I'd really just like to put a shout out to the team, acknowledging that they've put in a huge amount of work, and that, you know, sometimes it seems like that it's probably a simple thing, but it's actually quite complicated and requires a fair amount of skill for people to do that contact tracing appropriately, and the team is working really hard to do a good job.
Thank you so much, Dr. Peg, for that. Charlotte with APTN, do you have a question for either Dr. Kandola or Dr. Peg? Perhaps I'll head back to Charlotte, but Simon with News North, do you have a question for Dr. Kandola or Dr. Peg?
Yes, good morning. Thanks for taking my question. Can we just go back to kind of the discussion about clusters and community spread? Like when do we go from cluster to community spread? Like what are the sort of indicators of when we cross the line?
So that's an excellent question. And the fortunate thing right now is we have 5 cases that are all linked to each other in exposure. So we know the chain of transmission. And so with those 5 cases, we're looking at their contacts and isolating them. If we get a scenario where we have an individual test positive or a number of individuals test positive that have had no risk factors, they haven't traveled, there's no one in there, they haven't been exposed to people who have traveled, but then they become positive and they're not linked, then that would be considered a community spread. In the situation, we had a similar situation with GK Mine where we initially had declared an outbreak because we had a case linked to a case that a known case that had entered the mines. We had 2 and that was an outbreak, but when we had to declare the whole mine exposed is when we had a number of cases occur that were not linked in time, location, or work shift. Then that would have been the whole mine was exposed, so we had to react differently. But we're very diligent right now in this vigilant period. Is the good news is that we were able to identify the contacts for these 5 cases. We've asked them to be in isolation. The vast majority have tested and have come back negative, and some are waiting for the test results. So how quickly we can contain them, just in case they become a case, can prevent exposure to other people. So our main work the next 2 weeks is to continue to monitor the contacts to make sure that they don't develop COVID, and then continue to monitor across Yellowknife and N.W.T for any people who've had symptoms come forward, got tested, but had no link to these cases or the contacts and have had no exposure history. That would go into a situation where there could have been potential community spread. We're not at that point right now.
Simon, do you have a follow-up for either Dr. Kandola or Dr. Peg?
Okay, thanks. Yeah, I did have a follow-up. Why isn't everyone who leaves isolation tested?
So at this point, we follow the recommendations of the 14 days. 14 days is the period required for incubation. In the smaller communities, we are asking, because they don't have wastewater surveillance, we're asking for a day 12 test. Those are scenarios where, the exceptions where people have isolated in small communities. with our current order, if you're required to isolate in the regional hubs, and if you're an essential worker, we have provided testing for those individuals. In the regional hubs, typically what has worked well for us is if to do symptom checks on people isolating, and if on the 14th day they have no symptoms, they are released from isolation. And we've been relying on wastewater signals if there's any activity that we can anticipate. In this scenario, what occurred was we had unexpected activity on the April 14, 15, 16 composite sample, and that led for a public health advisory, and they led people who were isolated during that period to come forward and get tested. And this is what helped us find this initial case and the subsequent cases linked to it. But we don't test people typically on day 14 in the regional hubs. We follow the 14-day incubation period as being sufficient if you have no symptoms to be released from isolation.
Thank you, Dr. Kandola. Just checking with Charlotte. Charlotte with APTN, are you there? Or do you have a question for either Dr. Pegg or Dr. Kandola? Still not hearing anything from Charlotte. I did want to, this is something I wanted to ask Dr. Pegg, because there has been some questions about what a contact is. And perhaps Dr. Pegg, I was wondering if you could talk a little bit about contacts, what is considered a contact, and why do they have to self-isolate, and maybe how long do they have to self-isolate for?
Dr. Kandola actually touched on this, I think, briefly at the beginning, but I'm happy to go over it a little bit, and then perhaps she can add in some information if there's anything important that's been missed. So a contact is someone who's had interactions with a person who has known COVID-19 infection. So they have been in an interaction with that person, and that puts them at higher risk of acquiring COVID themselves. So people who live in the same house as someone with COVID would be considered a contact because they spend time in the same physical space, sharing a car, as was mentioned earlier, sharing certain spaces on the airplane, although there have not been any transmissions linked to airplane travel at this point, or other closed space would have someone considered to be a contact. Typically, there's a time frame around that and a space frame. So if someone was within 2 meters of somebody for 10 minutes or more, then that would put that person in the category of a contact. And you can see, going back to how the contact tracers have to do their job, that it can be sometimes a little bit complicated to figure out who might fall into that category. So that would be a contact. The other group of people that have been told to isolate right now are people who have been in an area where they may have been a contact, but because of the nature of the potential exposure, it's a little bit difficult to tell whether or not right off the bat there were actual contacts. So this is when those exposure notifications come out. So for a restaurant or for a gym or for the gathering that took place just outside of Yellowknife. And again, that's to widen the net, thinking that it's very possible that in that type of gathering, someone would have had contact with a person who was positive at closer than 2 meters for more than 10 minutes. But it's a little bit difficult to identify exactly who. And so the call goes out for anybody who may have been in that environment to come forward. And at that point, there's a more detailed investigation as to the nature of the interaction that potential contact had with the case. They would be tested, and then isolation instructions would be likely based on that interaction with the public health nurse in determining the level of risk. So contacts people who have had that level of interaction with a case. And those people typically would develop their infection between 3 and 8 days after exposure to the virus, but it can take up to 14 days. And that is the reason behind that 14-day isolation period for people who are named as contacts. The contact of contact idea is sometimes a little bit confusing for people, because someone who knows a contact, particularly maybe someone who is a high risk contact, thinks, well, I was in touch with this person who was a high risk contact, so shouldn't I be a contact? And at this point, actually, no. We don't treat contacts of contacts the same way. We want to do testing and isolation for the highest risk people and work outwards so that we're able to maximize use of our resources in the laboratory and for the contact tracers and for the people who are at the highest risk of developing COVID themselves. Which isn't to say, if people think they may have been potentially exposed, that they should ignore all of the public health advice or continue to do anything that they may see to be outside of those requirements. So if you think that you've been a contact of a contact, still important to keep a mask on, still important to keep physical distance, still important to follow all of those measures, and most importantly, still important to monitor for any symptoms, and if you do feel sick, to get tested.
Thank you, Dr. Pegg, for that information. Dr. Kandola, do you have anything you'd like to add to that?
Yes, thank you. It's an excellent summary. There are specialized situations which requires someone that can do a public health risk assessment and know the environment, where you could be in an indoor, poorly ventilated situation that's crowded, and there could be high risk activity, singing, or you could be working underground, that where we, and given the duration, we can expand the definition of contact and exposures, given the combination of crowding, poor ventilation, and an indoor location and the duration where people have been there for like over an hour, that we have expanded the definition of contact, because scenarios have shown that the COVID aerosol doesn't seem to obey the 6 feet distance and the 10-minute exposure in those scenarios.
Thank you, Dr. Kandola, for that. That wraps up our public health officials media briefing for today. Again, thank you to everyone who called in, logged in, and attended, and thanks to Dr. Pegg and Dr. Kandola for their time and providing this information to N.W.T. residents. Appreciate it. Again, any follow-up questions, you can email Darren_P_Campbell@gov.nt.ca. Yeah, thanks, and everybody have a great day.